Welcome to the September 2nd version of District Dialogue. I'm glad you all were able to join us tonight. I want to preface tonight's episode with the fact that, as you all may or may not know, we were informed of additional information yesterday regarding health guidance implications for COVID-19 that we really haven't had a full day to really assimilate. So we're going to present what we initially decided to present today, and that's our current health guidance, alongside what we do know about the judge-issued temporary injunction to Senate Bill 658. So we'll describe that later on in the presentation tonight. But first, I want to introduce our team. With me today is Mr. Sean Beard, Assistant Superintendent for Teaching and Learning. Ms. Janelle Wright, she's one of our illustrious school nurses. Mr. Jay Roeder, our Virtual Academy Director, and then Ms. Kristen Arnold, our Assistant Superintendent for Student Services. So welcome to this conversation, and I'm honored to sit with this team who have done an immaculate job of making sure we're doing the right thing, getting school started this year. So we'll go ahead and transition into our slideshow. So just want to talk about the title just a minute. We have hashtag Focus Forward 22. It's kind of our theme for this year. I will say that over the last, now starting the third school year really, dealing with the pandemic and trying to honor our students by providing the best educational experience possible, we will continue and are committed to do so this year as well. So we're asking for a good partnership and collaboration with our parents so that we can make sure we provide what kids need this year. So go ahead and move to the second slide. So this slide shows you where you can find the Ready Together Sandites plan. The link that Sean's getting ready to click on is going to take you to our Sanditesorg website. And when you get there, anytime you log into Sanditesorg, the first thing you see is a pop-up screen, because we wanted to make it very evident where to find the information that you may need for navigating this school year. So the first link is the Ready Together Back to School plan that was instituted when school started. That would give you the guidance currently to how we are mitigating COVID-19 this year. And then the second link that I know people are pretty interested in is our district COVID-19 reporting tool that's updated weekly, but by our new communications coordinator, Lisa Chittister, who reports that data out every Friday. Last year, we were doing that on Mondays. This year, we're promoting that on Friday once contact tracing is complete for that given week. And then the rest of those links provide lots of really great information regarding parents' navigation of the classroom, our calendar, Chromebooks, and then, of course, District Dialogue to the YouTube channel so you can see previous dialogue sessions. So one of the first things we want to talk about are just changes from fiscal year 21 to fiscal year 22. I'm going to ask this team to jump in anytime and kind of help keep me focused and on track. But there's just really three major changes that I want to notate tonight. And one is in our guidance, the word optional is used in reference to mask, and that is for students and staff. I know you're hearing a lot about other districts that are putting mask mandates in place at this point, but I just know that those mandates really are born with exceptions. And the three typical exceptions are medical reasons, religious reasons, or strong personal preference. And so just know semantically that language would indicate that students and staff could opt out of a mask mandate, even in those districts. This year, we're going to continue contact tracing our students, and we're going to continue parent notification of close contacts. That has been quite a chore, as you can imagine, but we felt like it was very important to make sure you all know if, in fact, your child has been identified as a close contact of someone with COVID-19. And then we're also asking parents of those close contacts to quarantine following the CDC quarantine rules. And Janelle, I don't know if you would want to insert anything in there, but that's been our procedure this year.
And our quarantine time is 10 days from the last contact. So whatever contact date you get notified of, we're asking for an elective quarantine of 10 days.
Yeah, thank you, Janelle, for that clarification.
Well, and also Superintendent Durkee, I just wanted to point out too that we do have a few teachers that have requested that their classes, their students in their class wear a mask because they might be immune compromised or they might have medical issues. I mean, they could be pregnant, just various reasons. And so those parents have, and the students have been notified as to kind of why, but we have to be very cautious because of FERPA and confidentiality and sending that out. But we do have some teachers that have requested that, and our parents and our students have been fantastic in trying to keep our staff and other students in the classroom safe.
We're finding that a lot of our Sandites are conscientious about the health and safety of others, including our teachers. And so there are some that have conditions by which they might be more vulnerable to contraction of COVID-19. The other thing that I want to make very clear is we have changed what has been traditionally in our guidance with nursing, what constitutes sending students home from school when they're sick. So on the next slide, we have inserted a chart that's actually in our guidance. You can find this located in pretty close to the beginning of our guidance. And Janelle, I'm going to ask you, if you don't mind, to go over this chart, make sure people understand what we're talking about, and the fact that a fever alone may not necessarily be the only reason we would ask a parent to pick up their children.
Right. Right. So this chart has what we're recommending is anything that is in the A category, just one symptom. We are asking parents to come and pick up their child and recommend testing. It is just a recommendation. Like she said, just a fever is not usually the only thing. We're looking at sore throats. Then over in the B column, we are recommending if there are 3 of those symptoms, and that is not just, you don't have to have an A symptom plus 3, just A or B. We're going to ask that you pick your child up. So that's stuffy noses, runny noses, body aches, everything right there that you see, loss of appetite, a fever 99 or above. So just a little elevated fever. We would ask you to pick them up as well.
Is it fair to say we've noticed that there have been cases of COVID-19 that are absent of a fever?
Definitely, yes. I feel like fever is a very rare from what we've been seeing. A lot of parents are calling saying they thought it was just allergies, sinus infection, and they're testing positive.
I think the biggest mitigation strategy, Janelle, really is not bringing COVID into the school.
Yes.
I know we were finding last year that many of our cases were cases that students contracted outside of school.
Right.
The likelihood of getting them inside of school is a little bit less. We're seeing a little bit of a different trend with the Delta variant, I think. But again, 2 weeks of data is not really enough to make strong recommendations at this point. But we just know that we are keeping that data.
Can I also say that as a nurse, if you do have to send a child home, this isn't saying that they're positive for COVID. That's not what that's saying. They're just saying that for precautionary measures, if the child falls under this, they're going to send them home. That doesn't mean the whole class is contacted to say that,
Correct.
little Susie had 3 out of symptom B, and so we're just letting you know that she was sick. That would be the parent would go and test them, and if they were positive, then that's when we contact the other students, not if somebody was over sick.
Good point, Ms. Arnold. It's a contact trace based on a confirmed positive case. Absolutely. So I did have a question that was submitted pre-recording about considerations for shifting to distance learning. At what point would we decide to shift a classroom to distance learning? And we actually have done that already in one classroom setting. And we're really talking about a couple of decision points that are really important. The first is classroom staffing. We were able to keep school open the bulk of the year with the exception of one period of time secondary and one period of time elementary in November last year based on the inability to staff the classrooms. And so if we get into a predicament where we can't provide a safe environment for students to come to school, then we would shift a classroom or potentially a building, but likely a classroom to distance learning. The other criteria would be student attendance. And so if we have a high rate of student attendance in a particular classroom, then that would be another reason why we might shift to distance learning for that isolation period of time. And then I think it's really important to make sure people know that decisions are made in collaboration with site and department leaders. And I say department too, because we have struggled, honestly, with our transportation department. We've had a few COVID cases where it did require isolation. And there have been a couple of days, to be fully transparent, that every single person with a CDL in our transportation department was driving a bus. And so that really makes me particularly a little bit nervous in terms of, are we going to be able to continue to bring our kids to school every day without making some major alterations in bus routing? So right now we're hanging in there. In the same thread of making sure you're keeping your children home if they are sick, it not only makes a difference in keeping our classrooms open, but also makes a huge difference in our ability to continue to provide transportation. It's so important for a lot of our students.
Well, and when we say departments too, it's not just transportation.
Of course.
Yeah. So you have to think about child nutrition, and not that we haven't really had any issues. That's going really smooth, knock on wood. But we've got child nutrition, we've got custodians, we have all those different departments that without them, they're just the everyday people that, take care of our kids and do what we need to get them fed. And so those are all numbers that we watch too.
Great point. And I think I was thinking transportation just because that's
where
need for now. Another question I had was about mitigation strategies. And of course, we're going to continue those strategies we were using last year. Cleaning, in terms of what's in the document, are strategies that we've incorporated in the district since the beginning of time, basically. So we're very conscientious about making sure we're using the products that are a mitigation tool for COVID-19 and other viruses and bacteria for sure. We are continuing to cohort our elementary classrooms. So that just simply means keeping classroom students together so they're not exposed to other grade levels or others in maybe the same grade with a different teacher. We are implementing seating charts across the district from, early elementary to high school, just for the mere reason of being able to trace close contacts of those folks who may have been exposed. And then, of course, intimately, we are sending parent notification to all close contacts and notifying classrooms if there has been a positive case in a classroom too.
That's also seating charts for buses too.
Correct. That is correct. A little trickier with the S's, but yes. So now I want to spend a little bit of time on Senate Bill 658. If you have not heard of this particular bill, this was a law that was passed in the 2021 legislative season. And what that bill does is basically disables districts from the ability to mandate masks unless an emergency is declared by the governor. The governor has openly stated that he has, at least not today, the intention of declaring a state of emergency in the state of Oklahoma. So that would mean that Senate bill would be in effect. The other point I would want to make sure everybody's aware, is this bill does not apply to private schools, only to our public schools. In yellow below in number 3 and 4, this is the part that we were informed of today. This is the very new information. I'm going to tell you that this will lend itself to our district leadership doing a second look at our protocol. We also need to fully understand exactly what this temporary injunction does. But basically, in a nutshell, today, an Oklahoma judge issued a temporary injunction that put a hold on the banning of mask mandates, but it does not take effect until the order is actually filed. Information received today from our State Department of Ed indicated it could be anywhere from today to September 8th. So we've got a little bit of time to step back and really understand the parameters by this temporary injunction and what it allows for. We had a state meeting there, I will say, was a little bit of confusion about exactly how that would work. But again, remember that even with a temporary injunction, the districts must, and this might be on the next slide, Sean, so yeah, districts must provide exemptions for medical, religious, or personal reasons. And again, there would be a form, much like an opt-out form for vaccines, that a parent would fill out based on one of those three criteria. So personal reasons is a little bit broad. It feels a little bit optional to me at this point, but again, we need to step back and take a peek at the parameters around it and get clarification. And then a second part of that injunction was that a mask mandate cannot differentiate between vaccinated and unvaccinated folks. And so we really are going to have clarification about exactly what that means in implementation. So I wanted to make sure that people were clear. This, again, was new today, so it would have been helpful maybe to postpone dialogue for another week, but really wanted to commit to what we had put out on our social media pages and go ahead and do this one.
But also stating with that first bullet, so if you know that you're going to fall in that area, we are not ready to accept exemptions at this time. We'll have a format for our parents and get that out to you if you feel that that's something that you need to do for medical, religious, or personal reasons. But at this time, we're not.
Good point, Sarah, because that would take a change in our district guidance. And so we review that periodically, pretty consistently. And again, go to the next slide. I want people to fully hear that we stay in consistent collaboration with our Tulsa Health Department, collaboration with our district nursing team, and then we also use our district data to make some determinations, and they're reviewed consistently. So that's something our team will take a step back and look at in regarding changes to that document. And as soon as those changes are made, we absolutely will share that out with all of our communication pathways so that everyone has an opportunity to review consistent protocol. So I'm going to shift. Actually, Jay, before you start with the virtual change, and I know you want to talk about it, there was a couple other questions maybe that I need to answer that were submitted earlier. And one of them, I'm just going to read it if you don't mind. It says the CDC indicates that ventilation is one component of maintaining healthy environments and is an important COVID-19 prevention strategy for schools and child care programs. Can you please tell us on a site-by-site basis if portable air cleaners with HEPA filters are being employed? So I'm going to start with that one. And the only site that I know of that has portable air cleaners is Angus Valley. That site principal was able to write a grant, pre-COVID, by the way, to Solace Church and was able to purchase those air filters that are mobile. The next question, if not, what other air circulation and ventilation is being employed? And I love this question, by the way. We've made control adjustments on units, HVAC units across the district that allow for the maximum amount of increased airflow of outside air, which is a strategy just to keep the airflow going in, not just regenerating the air, but coming in from the outside. We as a district have begun replacing our old HVAC units that are, some of them are incredibly old actually, that allow for better efficiency throughout the district. Our accountability mechanism, which I believe is the third part of that question, are there site-wide accountability measures? And our maintenance department is on top of that, and they're responsible for making sure those things are working and maintained. We actually hire an independent contractor that does quarterly inspections on all of our HVAC units. So that would, I believe, answer the first question. The second one, as a supporter of masking, is there discussion of mask mandates similar to what TPS just implemented? I'm not familiar completely with the TPS regulation, quite frankly. But I did pull an article. I do know they have exceptions to theirs as well. Again, I think going back to this idea of with the new injunction of Senate Bill 658, that would be something we'd step back and take a look at. So I guess the answer to that question, is there discussion? The answer is yes. At what point do we quarantine an entire elementary class? I believe I addressed that. We have already, based on staffing and attendance of children in collaboration with our site leader. And I think the last question, I cut it in half, and I'm just going to read it as it was submitted. According to the last board meeting, your reentry plan leaned heavily on the fact that there were almost no COVID cases during the elementary summer camps, which is true. Now that the school has started and the evidence is showing the trend is not continuing, and this person reflects the Tulsa World article about cases up 125% after the second week of school. How do you plan to change your approach to COVID policy to make this safe learning space for students, especially those who don't have a choice to be vaccinated? And again, I think it's taking a step back and really focusing in on our data and the ability we have based on the injunction to offer some strategies. Just know that even in a atmosphere where there are opt-out parameters, we still are at the mercy for folks to not opt out and wear the mask. So again, that will be reviewed very soon to get a kind of a district stance on how to go about that process.
So just really quick, Superintendent Durkee, because apparently I am that person. But I just want to address really quick, because we have the after-school learning programs that are happening. And then we also have 21st Century and some other things. And then I know we have some services that our Virtual Academy office offers that's after, like our regular school day. And so for parents, just so you're aware, same thing applies for masks. I mean, none of what you've looked at on that Ready Together changes for those times right now. And then also for football games, whatever, it's all in the same mode. There's no other strands that are running out there, for lack of a better word.
I will say our transmission data, I believe I reported 1.27% of kids that were on required quarantines last year coming back with a positive case. We're trying this year to kind of differentiate that between elementary and secondary, because there are vaccines available for our secondary students. Anyone over the age, 12 and up actually, is eligible to have a vaccine. We, of course, would encourage that. Of course, it's a personal choice that you have to make, but it is available. And I want to make sure everyone understands that that is available to our secondary students. But the percentage is still very low of transmission in the classroom overall. I think elementary, and again, this is very preliminary data, but we're talking right at 2%, I believe. So it is very low, but again, we need to be conscientious of making sure that we're making the right decisions for our students and their health and safety, and our staff too. I think that's a big degree of concern for our people. So I do want to shift and let Jay have an opportunity to talk about an elementary shift. If you are a parent of a virtual school elementary student, you may have already heard this information from Mr. Roeder before, but I wanted to give him an opportunity to talk about where we're at in the elementary virtual change, and make sure you had his email information as well. So
yes, so we started the school year very small enrollment for elementary virtual. I mean, teachers reported back to school, we had 7 students committed to elementary virtual. And so we made a plan to work with our site teachers to provide the elementary curriculum for the year. And then numbers have increased. And with that increase, we have posted and are in the process of onboarding 2 additional teachers at the virtual academy to handle pre-K through 2 and 3 through 5 students. Those teachers are going to be working with those site teachers to make sure that they're planning alongside all 5 elementary sites to make sure that when students transition in and out, while we hope that doesn't happen a lot, we know it does happen as circumstances change, but students will be able to just slide right back in and know exactly where they were in the classroom. We do have our tutors for elementary on Tuesday and Thursday evening. And Thursday evening, that tutor is also a reading specialist, and she works with those kids on all of their phonics and everything going through to try to help them improve their reading ability.
I do think it's important, though, Mr. Roder, to let people know that we do have the option of the virtual academy. 58 elementary students is much different than the enrollment we had last year, which topped at 350 at some point.
Yeah, at the beginning of the year, yes, we were at 350. And a big part of why our program is different is the virtual academy lab, where students can come see their teachers in person, one-on-one. We provide lunch if they're there at lunch. We go pick up their lunch from the high school and bring it back to them. So they still have the option of seeing their teachers and getting tutoring throughout the day. The lab opens at 8 a.m. It doesn't close until 6:30, Monday through Thursday. And it's open until 3 o'clock on Friday, when all the teachers go to PLCs at different sites around the district. So that lab just provides options that aren't available in a lot of circumstances around the state. So we encourage parents and students to take advantage of that. And there are kids that spend a few days a week with us up there.
In the lab. So to go from 7 to 58 probably is an indication of what we're seeing in a trend with COVID now. Definitely that will be available. So I appreciate your work, Mr. Roder. You've done amazing, making sure that parents have all options to educate their students. I will say the virtual piece does require a little bit of collaboration with the parents to make sure that that's happening. And lots of you guys do it very, very well.
Absolutely.
So,
yeah, it's definitely a partnership between those teachers and their parents.
right. I would just end, and Sean, you haven't spoken a whole lot. So do you have?
Well, we do track our virtual student numbers too.
Absolutely. Yes. So, and they report. I will
Yes.
say, just to commend some of our folks out there that are choosing to go ahead and self-quarantine based on the close contact is very much appreciated. And Janelle sitting here nodding her head going, yes, it is, because they're staying really busy. So those of you that are choosing to do that, thank you, because I do know that it's a very healthy mitigation strategy to make sure that we're keeping the doors open. I am a firm believer, especially for our younger students, that in-person instruction is the best way to learn. I think that's indicated by the pretty big shift from last year, from the high point 350 to 58. I think parents realize that as well. And so we're just asking you to help us keep our doors open, keep kids home if they're sick, and do what you can to help mitigate the spread of the virus. So anyone want to add anything before we say goodnight?
I've been pretty quiet. I know
You
you
have
said
been.
that. I just have to agree wholeheartedly with everything you guys have said. I mean, everyone's doing a wonderful job trying to keep everything going with the school district. And I know Mr. Roder's been working hard with our virtual program. So
Absolutely. Absolutely. Well, I think that's it for tonight. Just watch for updates. Your best bet is probably our social media pages, but we will be sending out notification via our Aptogee app with a text message. I know that's sometimes a little bit too much for people, but I think it's the quickest way to get to people to make sure they know that the health plan, if in fact it does change, you'll know that. So other than that, Lisa's sitting in the background, our communications coordinator. I probably left something out. So Lisa, is there anything? Okay. She's shaking her head no. So we're going to call it a night. Thank you, team, for being willing to get on the camera and talk through this with our public.